Hi, do you get headaches or neck pain? If you have chronic neck pain, the posterior cervicals are muscles that can be in an overcontracted state that provoke chronic neck pain and can even result in what you would refer to as cervicogenic headaches. I spend a lot of time in my practice working on these muscles to particularly help alleviate chronic neck pain and even some headaches. So the semispinalis cervicis and the semispinalis capitis, these are your posterior cervicals, are a culprit to chronic neck pain. I'm going to show you where they are and how to address them in order to help alleviate chronic neck pain. Hi, I'm Dr. Catherine Price, and I'm a physical therapist. I'm going to go over trigger point release that may help alleviate chronic neck pain. This is going to be beneficial for folks that spend a lot of time looking down for long periods or are in that forward head posture. And you can take charge of your own health and start to help diminish this pain working on it on a daily basis. So the semispinalis cervicis and the semispinalis capitis, they're going to originate on the base of the occiput, so on the base of the skull, and then they're also going to attach from the C2 spinous process to my C5 spinous process. So that's where they're going to originate. Then they're going to connect to the articular processes, which is going to be right where you feel the bones in the center of the neck, on the back side. If you go right to the edge, you're going to feel a layer of muscle. That's going to be your posterior cervicals. So they're going to then attach the articular process of C3 through C7 and then down into the transverse processes of T1 through T6, and that is going to be between my shoulder blades. So between my shoulder blades, those muscles are going to elongate and follow that line. So what I do is I'll take my fingertips and I'll go right on the opposite side, so going right next to where those bony prominences are, and I'm going to just feel that muscle tissue, and it may feel really tight and tense if it's over contracted, and it can be tender. So you just want to apply the pressure that is comfortable for you. And as I'm pressing in, I'm going to gently extend or shorten and look up slightly just to keep it shortened. And I'll just hold that and hold the pressure for about 15 to 20 seconds. I can work on the fascia for up to 2 minutes or longer. And what I'm looking is for a decrease in the tenderness as I'm applying pressure. Now you can also do this on your back so that your head is supported. So if I'm lying down, I'll just allow my fingertips to sink in and press upwards towards the ceiling as I'm holding that area. And then the head is going to be completely relaxed and supported, and you want to relax the neck as you're applying pressure. Same thing for the other side. I'll take my opposite hand, and I'm going to go to the opposite side, find those bony prominences, come to the other side. I'm going to apply pressure forward, and then as I'm applying the pressure, I am going to shorten and extend my neck or look up slightly. And just rest my neck and head into my fingertips and hold that position. Again, I can lie onto my back and let my head rest as I'm applying pressure, holding for 15 to 20 seconds over a tender area, looking for a decrease in the tenderness or the pain. And you can work on this as for up to 2 minutes or longer and periodically throughout the day. Now that is the posterior cervicals on the neck. They also are going to then go down between the shoulder blades. And this is why the literature is showing that mobilizing the thoracic spine is a evidence-based intervention to help alleviate chronic neck pain. So what I do is take 2 lacrosse balls. You can use 2 tennis balls in a sock. You can use a softer surface. These are a bit firm, so it may be too uncomfortable to start with. And I will mobilize that area using these. If it is too intense to put body weight, you can do this up against the wall to start with. But what I'll do is place them right between my shoulder blades. So I'm going to start right here. And then I'm going to lie onto my back and apply pressure, supporting my head and neck, and just relaxing my head back and letting the pressure on those areas until I feel a reduction in pain. And then I can mobilize and move down to another area. And I want to do this between the shoulder blades. So between T1 and T6 is going to be the attachment points of those posterior cervical muscles. So that is trigger point release for the posterior cervicals. After doing that, sometimes it is helpful then to traction the neck or let those muscles just stretch, and you can just hang your head and allow the stretching of those muscles after you've released them to help restore that muscle tendon relationship. So that is something that you can do. You can use cervical traction if it's an appropriate intervention for you. Sometimes I will even use a cervical collar and place that around the neck just for a cue, not to be looking down for long periods. And it just helps to hold and re-educate that alignment. It's not meant to take the place of your muscle strength in the neck. And you can always work with a therapist to help you restore the strength and the positioning of the head and neck. And once you release those trigger points, if you continue to do those same positioning and postures, they'll tend to return. So you do want to work on getting out of that forward head, that continuous holding of the head forward posture, and working on the realignment of the ear in line with the acromion so that the cervical spine is stacked and alleviates the stress and strain. And the other thing too is that when we are tense, we tend to hold ourselves into a forward head elevated position. And we want to be aware of that so that we can change the positioning. So working on the muscle trigger points and then helping to reposition can be a great tool to help alleviate and diminish chronic neck pain. I hope this is of help, and have a blessed day.